Hi there, my name is Nicholas Coda Ramos. I'm doing my IV catheter insertion. This is my setup, my mirror, Jack. He's just eating ice cream back there. And this is what I've got going on. So, I'm gonna go ahead and start. I scan my room. So when I come into the room, I perform hand hygiene and I do my two patient identifiers, Jaguar J. Jones, Jaguar J. Jones, MR number 417-6352, 417-6352, got that. Then we assess for any allergies, penicillin. And then I'm also gonna identify and clarify the order form and the hospital policy. So we're doing IV catheter insertion. So I tell the patient, we're going to be doing IV catheter insertion. Cool. After that, I reposition my trash. My trash is right here. Perform hand hygiene again and put on my goggles. I already got them on, so I got my goggles on. Then I would raise the bed, lower any side rails. I'd be working on his left side. So what we're going to do is lower his left side rails. And then I'd put him in a good position, whether it be supine or sitting. Today, we're going to say he's in a supine position. Then I'd open everything up all the way, so I have my J-loop. We're going to open everything with asepsis technique, so kind of like sterile technique, just not. So I open everything up. Don't need this falling out again. Open that, open up my saline lock, open that up, open my IV starter kit, open it away from me, and come on. Fold. That's good. And then also my IV catheter. I believe we're using a 22 gauge. I already opened this one, but you would open it away. And then this is my alcohol prep pad since I ran out of all of them for the med admin. So this is my simulated one. So after I do that, what I'm going to do is I'm going to prepare my J-loop. So I'd come in here and I would clean this off. Clean this with my alcohol swab. And while doing that, I will prime my saline. I'm going to connect it and prime my saline J-loop. So I'd hook it in just like this. Take this out and then loosen this a little bit and prime it. All right, it is primed. So I'm going to put it back into its container thing. Then what I'm going to do is I'm going to take out my tegaderm from my thing just so I have it ready. Put it right here. After that, I'm just going to explain a couple things. So I'm going to explain how the selection of selection of veins. So I'm going to make sure that I use one that is not above any vascular valves, or venous valves, sorry, we don't want to hit a valve. And then also any flexion sites, so none in here or none in here in my wrist. And also I'm going to avoid any bruising on the arm. Then when you're fostering a vein, trying to get it to pump up, you could have them clench their wrist once the tourniquet is on. You can apply some warmth to it with like a warm rag, or you can kind of rub it or milk the vein so it kind of pops up a little bit. Okay, so now that I did that, I'm going to apply my tourniquet. So with your tourniquet, you're going to apply it 4 to 6 inches above the site. So I'm going to put it right here, and you're going to do a loose, but you can't see it, a loose kind of like a easy out knot. So like this, so in case I need to take it out and just rip it. So we did that. Now what I'm going to do is I'm going to apply my gloves. After I apply my gloves, I'm going to cleanse the site with a chlorhexidine swab. And with the chlorhexidine swab, you're going to push on the little tabs and it'll pop. I already used it, so we'll just go click. Oh, it's crunchy. And then what I would do, I'm just gonna hold down the arm. Friction, up and down, side to side, just like this. And just put it right here, throw it away. And then you're gonna let it sit for 30 seconds, and that would be that. Then what we're going to do, after it's cleansed, you're going to take out your IV catheter. You're going to take it out, take out all the things, throw it away. And you're going to insert your IV catheter. So you're going to do it bevel down. Bevel down. So the bevel is down. You're going to anchor it at a 10 to 30 degree angle. And you're going to go until you can see blood return. So we're going to go just like this. Oh, simulated blood return. Once you have that, you can go all the way in. And once you have it in here, you're going to put pressure right here. You're going to take out the needle, put it in your sharps container. After you put it in your sharps container, you're going to, after the sharps container, you're going to connect your saline. So what I'm going to do here is I'm going to take off this cap and I'm going to connect it. So you're going to twist it on. After it's twisted on, you're going to aspirate a little bit just to see if there's blood return still. Then you're going to flush it. I'm going to flush the pool noodle. Oh, no, I'm not flushing the pool noodle. Okay, so you would flush it right now, or maybe I can flush it. Oh, no. Okay, we're going to flush the pool. We would flush the arm. Sorry, ignore that. So after you flush it, then you're going to put on your temporary tape. So got my tape right here. This is your temporary tape. Now you can let go of this since it's taped down. Then what you're going to do is you're going to get your tegaderm. And once you have your tegaderm, it's a little wet from when I tried to flush the pool noodle. You're going to take the tegaderm and you're going to take it off the whole thing like this. And then you're going to plop it down, not on the port. Oh man. Not on the port, but above the port like this. Put it down, smoothen it out, and then take off your excess, making sure that's nice and flat. Okay, got my tegaderm down. Throw this away. Okay, now that you did that, you're going to put your final tape. So you have your tegaderm down, so you can take this tape off, throw it away, and then you will loop up your saline lock so it's in like a natural position. Take your final tape and you're going to tape on the J-loop. This is a big piece of tape. Tape that down. So now it's, ooh, nope, stay. So now it's like this. This would be flushed. I can't because it's the pool noodle. When you flush it before, you're going to assess for any swelling too. I forgot to mention that. So now I have my final tape on. I would throw everything away, roll this away. After I throw everything away, I'm going to write down a third piece of tape. And on this third piece of tape, you would write down the date, time, the size of your IV catheter, and the initials, your initials. And you'd put it right here. I did a little low, but you're going to put it right there. And then after you're done with that, you can reposition. You're going to take off the tourniquet. I could have taken the tourniquet off a long time ago, actually. You would take the tourniquet off. After you flush it. So after you do that, oh my gosh, hello, stay. Okay, well, so after you do that, you reposition your patient and perform hand hygiene. So he's already in the supine position, but if he wants to sit up or anything like that, and you put your side rails back up, you take your gloves off, glove to glove, skin to skin, throw them away, perform hand hygiene again, and then you're going to document. Once you're documenting, you're going to document the date and time. The date and time, the amount of attempts it took for you to put the syringe in, and then, or the syringe, the IV catheter, and then you're going to document the size, like the gauge of your IV catheter and the length, and you're also going to document if there's a presence of a saline lock and the tolerance of the patient's tolerance of the procedure. So now that's in, what you're gonna do is, oh, I threw it away. So now what you're gonna do, this is gross, don't do this. Now what you're gonna do is you're going to discontinue. So when you're discontinuing, you're going to perform hand hygiene again. Okay, when you're discontinuing, you're gonna perform hand hygiene again, and you're going to put a gauze over the tegaderm, and you're going to observe, or you're gonna put a gauze over there. Oh my gosh, sorry. Put a gauze over it, and you're gonna take the tegaderm off. So once you're taking the tegaderm off, I need to reuse this again. So you have a gauze over here. You take the tegaderm off, and you're still applying pressure. Then once you take the tegaderm off, you're gonna put a clean gauze over and take all the other tapes off. You're gonna take it out, it's already coming out. So then you apply another clean gauze. And then you're going to apply another new piece of tape over the gauze. And you're done. Okay, and that is it.